So as people are sort of wrapping up, we're going to go through a few slides just to help sort of orient us to how we should think about developing a research question. And then once we've sort of talked about that, we can revisit our research questions and see if maybe they need some tweaking. And then what I'd love to do is have people even share sort of the evolution of their research questions, and maybe if there's any way that we can give each other sort of peer feedback on our research questions to help each other sort of maybe move our research questions from one stage to the next. So a research question has, a good research question has several attributes. It should be clear, focused, concise, complex, and arguable. And I think one of the most important pieces about a really good research question is that you personally have to be passionate about it, right? Because this is probably something that you're going to spend a lot of time on, spend a lot of time thinking about. It may even set you up for your career. And so you personally have to be very interested and very passionate about it, in my opinion. I think it's easy to be opportunistic about things and hear about good research questions and think, okay, well, maybe, you know, my mentor or somebody suggested I should be doing this, that, or the other thing, but it's not really something that you care a lot about. It's going to be hard to maintain the energy that you need, I think, to push that all the way through if you're really just doing it because someone else thinks it's interesting and thinks that's what you should be doing. So my personal opinion is it's good to have a balance. You want to be somewhat opportunistic because we all want to be funded at some point. But I think you have to find that sweet spot of something that you really care about and something that other people care about, and we'll touch on that a little bit more. So why is a good research question essential to the research process? Why is it important to have a good research question? There's lots of reasons. Throw a couple out.
If you can't communicate effectively why you're doing the research, it's really hard to disseminate that research or like explain that research.
Right? Great. And so communicate, you have to be able to communicate that question to others. I'm just going to repeat this into the phone for the people who are on, into the mic for the people on the phone. Other reasons.
It needs to be measurable.
It needs to be measurable. Yeah. Why is that important? That's part of developing a good research. So it assumes that measurable is part of the definition of a good research question, right? Other reasons?
I mean, it determines the whole study design. You got to know what question you're asking in order to use your study to answer it.
Mm-hmm.
So it kind of
helps you set up the design, yeah.
I think if the research question doesn't make sense, the results would not make sense either, so you can't choose your results.
Right, so setting up the good research question at the front end helps you interpret your research results later on. Otherwise, if it's just a casting a wide net at the end, when you do have a result, if you didn't start with a good research question on the front end, it's really hard to interpret your results, right? Anything else?
I think that's significance or clinical significance important to some discipline.
It has to resonate, right? Yeah.
It keeps you grounded, gives you focus and direction. Instead of doing 100 things, you can just do 3.
That is probably the key reason that having a good research question, there's lots of reasons to have them, but one of it is it grounds you and it helps prevent you from wasting time and spinning your wheels, right? It allows you to focus. So it's really important, I think, to spend time being thoughtful about your research question on the front end. Okay, so how do we do that? So steps to developing a research question. So the first one, and this was kind of mentioned, is to choose an interesting topic that you and other people care about. And then start thinking right up front, who is this important to? Who is your audience? Who are you going to pitch this to? At the end of the day, when you write about this, who's going to care about this besides you? So you have to start thinking about your audience so that you can frame the argument and communicate up front to the audience that you intend for this to ultimately land with. And that might be multiple different groups, right? So thinking about that and how you frame the question on the front end so that it resonates for the people who you want to receive the message on the back end, that's important. And you can think about that as you're formulating your question. And then you do some preliminary research on your general topic. So this is where you start to say, okay, this is kind of my idea. Now what's already been done and what questions remain out there related to this topic. And one thing I think you want to keep in mind, and this kind of a forum is great for this. I think sometimes we all live in our own silos, and whether it's a clinical silo or a particular behavioral silo, we all are used to our disciplines and the semantics and the words that we hear and use within those silos. And so I think a lot of times, we come up with a research idea and we think this is really important and no one's done anything on this before. And we look in the literature using the words we know and we don't find anything. And then lo and behold, there's a whole different discipline that uses a different word for the thing you're thinking about. And there is actually a huge literature on it, right? So that happens all the time. So I think that's one of the reasons that Friday Fellows is important, getting up and presenting your work in front of an audience that has a lot of different disciplines so that you can learn about other words, other vocabulary, other topics that are very related to what you're doing, that you may bring in literature or findings or information from another discipline into the very topic that you're doing. How many people have had that experience? I mean, yeah, it happens all the time. Okay, so then you've already looked at it, you've kind of hypothesized, you've done the literature search, you've landed on a topic, now you start to think about what are your hypotheses, right? So, and as you think about this, and I don't want you guys to feel stumped like you're thinking about the research question for the rest of your career. I think sometimes there's a lot of pressure, like think of a research question and then you think, I'm building my career on this one. You can have overriding objectives or goals that then have multiple research questions embedded in that trajectory, okay? So as you hypothesize, and think about what you think you're going to find or what you wish to answer with this particular question, I think you want to see it in a series of steps that's going to take you forward on your career. So how does this research question inform that trajectory? Where is this going to take you? Does it have legs? Does it lend itself to further questions down the road? What kind of arguments are you hoping to make? So what do you believe as you're coming in? But then what's going to happen if you find that actually the research you do doesn't support your original hypothesis? What's going to happen? I think it's always important, because you're passionate, hopefully, about what it is you're doing, you probably have some hypotheses coming into it, right? But as scientists and as investigators, it's important to maintain equipoise, which means if you already believe something, then you're really not, and you want to implement it, you don't really believe that there is a question scientifically. You should just go do that thing then, right? But if you're doing a study and you're really doing research, then there's some equipoise. We're not sure we know the answer. And so you have to enter it with that in mind. So even though you have a hypothesis about the way you think it's going to go, you have to entertain the idea that this may not be the way it goes. And so you think about how will you frame that. And then as you start to generate your hypothesis, you have to start thinking about what is your data source going to be? Do you have what you need to test the hypothesis that you're coming up with? You guys feel free to stop me as we go along. Okay. Now, as you've figured out that the topic is relevant and you've figured out the gaps in the literature and you've devised your hypothesis, now you actually have to start putting down, and this is what we just did, try to put your research question down on paper so that you can start fleshing it out, because this is really an iterative process. So you want to think about, is your question original and phrased in neutral terms? It's back to that equipoise concept. Is it clear? Is it focused? And is it complex? And we're going to kind of go through each of those latter pieces just so that we can think about what those words mean and what that means for developing a question. So first we're going to talk about clear versus unclear. So here's an attempt at a research question. Why are social networking sites harmful? So what do you guys think about that?
It's negative valence from the beginning, so it talks about it being.
It's not in neutral terms, great. It's negatively tilted already. It assumes there's a harm.
What does harmful mean?
It's nebulous.
Yeah, very nebulous.
It's not clear.
Yeah.
Okay, what else is nebulous?
There are so many different social networking sites.
Great, great, yeah. So things that you could do to change this. Does anybody want to take a stab at changing it to something that's more clear?
What are the impacts of frequent Facebook use on depression levels?
Great. So what are the effects of frequent Facebook use? I'm not going to be able to repeat all these all the time. Frequent Facebook use on people with depression. Is that what you said? On depression levels. Great. Great. Yeah, I think that's a great option. Another option, how are online users experiencing or addressing privacy issues on social networking sites such as MySpace and Facebook? So whatever it is, taking, that's just an example of a way to make it clear. I think your example works great too. So how do we just try to take the negative out of it and we try to put some more specifics into it. Okay, great. Focused versus unfocused. What is the effect on the environment from global warming? Very general, right? And you can imagine what happens when you enter into a literature review with an unfocused question. You spin, right? And before you know it, you've pulled, 50 articles, and then you look at the reference and you're all of a sudden you're doing tangential. You look back and you say, I don't even know how I got to this article, and it's not helpful. And part of it is because you really didn't know what you were looking for to begin with, right? And there's so much out there that's published, you can just be drowning. So I think that's the key piece of the focused versus unfocused. So an attempt at making this more focused might look like, how is glacial melting affecting penguins in the Arctic Circle? I took these off of the internet. I did not make these up. So that is an attempt at making it more focused. Yeah, Carlos.
You have to piggyback on something you mentioned before.
Mm-hmm.
And that is, sometimes this is a good process to think about ideas and research ideas, and when you're talking about it, once you're trying to define that. A couple of caveats is, as you are doing this, sometimes you hit a brick wall, and the brick wall may be ethical, maybe religious orientation, because that example of global warming can derail someone's career in the current setting, as an example. So don't think about it, just get with your science and follow the advice that the chairman provides.
Great, yeah. So I think that speaks to considering who your audience is, thinking about how your questions inform your career, and just reminding people to approach this with balance. I mean, you could see the same thing happening with something like gun violence. There's all kinds of, doesn't mean you don't do it. It just means go in with your eyes wide open and realize, and try to anticipate some of the feedback and arguments and resistance you might get to particular questions you might ask. Okay. All right, moving from focused into unfocused. Oops. So appropriately complex and too simple. So the point here is you don't really want to ask something that's just going to be a simple yes, no answer. You'd like to ask something that's appropriately complex and that's going to have, as I mentioned earlier, legs, right? So you want your answer to this question to probably inform your next steps. So some kind of a, it might be an intervention, or it might be, what is it? Oh, how do I get it back from there? It's not going to be something that you can just sort of do a one and done with, right? So an example of a very simple question is, are doctors addressing diabetes in the US? And actually you could say that that's any one of the things that we've just talked about too. It's probably not focused enough. Maybe it's clear, but it's very simple. So something that's more complex would be, what is the most effective second-line agent available in the US to treat adults with type 2 diabetes after metformin fails to maintain glycemic control? And that's actually the research question of a very large NIH trial that's going on right now, that's in, I think it's in its 5th or 6th year, with 37 sites across the country. So that's a fundable question with legs that will have an impact on clinical care. So it's a much more complex question than just, is the care good, yes or no? Okay, and then the last little reminder is just to be flexible, and I think as Carlos is kind of suggesting, this is really an iterative process. So it's normal to start with one question and for it to evolve and make its way into a separate question, because you get in there and you find out that there's tons of literature on the thing that you're looking at, but you want to focus on one particular aspect, or there's no literature on something, and so you really can't even support the research question that you think you want to do an intervention on something, and then you find out, well, actually nobody's even proven that there's an disparity in the outcome you're trying to affect. So then you have to back up your research question, right? And you have to start thinking about, how do I build the evidence base for the question I want to ask? So you have to shift sort of your focus, if that makes sense. So these are just some references that you guys can use if you decide you want to go think about this some more. But I think what would be best now is for us to actually work on thinking about our own research questions. So I want you to go back now and look at your research questions. And I want you to think about it with these kinds of factors in mind. How does your research question look? And another way to think about this, I think, is, we think about this a lot when we think about setting behavioral goals, but I think some of the principles can also be applied to thinking about something like a research question. How many of you guys have ever heard of SMART goals? Right? So SMART stands for specific, measurable, you mentioned earlier, achievable, relevant, and time sensitive. And I think that in some ways, thinking about that mnemonic and those principles lends itself to developing focused, clear, and appropriately complex questions. So that's another way to look at your research question and say, is this specific enough? Does this research question stand alone, or does it require me to go and give a lot of more explanation? You'd like it to have enough specifics in it that it makes sense to someone when they see it. Is it measurable? Can you even measure this? Are you going to be able to get your hands on the data that you need to measure it? That goes along with achievable. Measurable and relevant, so that's your argument to the audience. And then time sensitive. Do you need time bounds on this? Are you going to look at this throughout time, or is this in the last year? So thinking about those principles as you look at your research question. So go back and kind of take a few minutes now to hone your research question, and then we may share them with each other. Okay, I think most people are wrapping up. So while the last few people are finishing up, I should have asked this at the end, but before we launch into discussing our actual questions, does anybody have, and especially after now trying to do it, does anybody have any questions or particular challenges in trying to do this?
Yeah, so I think with where my mind is going, there's almost different nuances or different, I guess, thinking forward to sub-analyses that I'm trying to get at with one research question.
Mm-hmm.
So maybe it's a broader concept, but there are multiple levels of that concept I'm wanting to measure. So how specific do I be in my research question? Do I list all of the, modifiers in one research question, or do I just say a broad?
Yeah, I think that's a great question. And how many people kind of struggled with that a little bit? Yeah. So I think the best way that I would welcome other people who've done this a lot, input on this. I find that when I'm reading, I find this nicely articulated in a lot of people's K's, career development awards. And it's sort of when you are presenting yourself and you're trying to think about where you're going and what you want your research to be. A lot of times people will say, my overarching goal or my overall objective. And that's sort of a programmatic piece, right? That's like your umbrella of your research. My overall goal is to identify factors and create interventions to reduce disparities in diabetes outcomes. That's an overall goal, right? That's not very specific. That's not a research question. That's an overall objective. So I think thinking about your program, your personal career goal or objective or research trajectory is a way to frame research questions that then are much more specific within that. And that's when I was talking about trying to come up with your question that then leads to the next thing, that leads to the next thing, so that you have more of a research program with legs. So I think you want your research question to be very specific. So it is kind of almost thinking about it like a sub question or a subtext. Anybody? Yeah.
Yeah, no, I think my approach is to do the overarching question and then have separate questions for the other kind of deeper dive. So I find it hard if you do is there an overall effect? And then I want to look at mediators, if it's all lumped together in one question, for me at least, it becomes very overwhelming. So if there's I want to evaluate the overall effect of missed HIV primary care visits on mortality among this sample over this time. Then the second question is, I want to, evaluate, are there differences by age, race, so my approach is to kind of make them into separate questions. One is more broad and overarching, and then the next question is saying, beyond that, and sometimes it's contingent upon that being an issue, and being, proven, the sub kind of questions. Or else, I don't know, else for me it becomes like, oh my God, I can't keep up with this, and.
Yeah.
Other input, Ken, Carlos? Yeah?
These conversations made me think about something else. One is, if you're writing this for your K, your proposal, your IRB, the format and level of detail may be slightly different than out of this output, I'm going to submit this paper that has 2,000 words and this is it. So I think it's what's the purpose after you know what you're going to do, the level of detail, the format, and so forth. So I didn't think about that until giving this conversation.
Yep. I think that's a great point.
I agree with your general approach, and I always like to start bigger and then try to narrow it down. And what will narrow it down is how much you need. Is it going to be feasible? Feasibility is one of the big questions that often is leveled against an early grant, and it's a real easy critique to make as a reviewer. It's too big, can't do it. Too much time, not enough resources, too expensive. These are things you don't want to take that sort of a hit. But if you start big, I take the same approach to writing papers. Start big, start with everything, and then it's always easy to edit things out, to try to refine and narrow. But I think starting with the broadest domain of what you're interested in, and then trying to narrow it down, depending in part on what you think you can actually accomplish and what resources you have available. I think those are some of the keys.
Okay, great. Any other questions?
I would just comment, I think you made a really good point earlier that like, ultimately your goal might be to do the interventions. Even sometimes when you're doing the formative research question, you said this, I think thinking about where you ultimately want to see it go can be helpful. Because sometimes that even thinking about where you want to go, I don't know, for me helps shape the question that I ask now. So if I don't include this now or ask this now, I'm not going to have the information I need 2 or 3 steps ahead. Sometimes it's hard, but sometimes trying to think ahead and then working backwards I find helpful, and sometimes modifies, you know, what asking for that first big picture question.
Mm-hmm. Yeah, I agree.
As long as you connect it, you have to close the loop. I see that that's some of the reviewers I get. This is your overall goal, these are your questions, but I don't see the connection back to your overall goal.
Yeah.
Right? It's like, oh, you're going super detailed, you're not. You usually close that aims page with, this is how this is going to get me back to
Exactly.
point A.
Yeah, because you can get so specific, yeah, that it almost seems like it doesn't tie back to the umbrella, but you want to close the loop. I think that's great, especially to Carlos's point, depending on what you're doing. But even in a paper, it's sort of a microcosm of that as well. Okay. All right. Who wants to share one of their questions and maybe the evolution of their question? I don't know, Becky, we can't do this with a mic, but I mean, I don't know if they'll be able to. Can they hear us? Do I have to worry about this? Okay, great. Good. Okay. Anybody? Anybody see an evolution in their question that they want to share with the group? Anybody need help with a question that they feel like they haven't gotten it quite where they want it and they would like input from the group? Yeah.
So in surgery, for our colorectal patients at UAB, we do something called the enhanced recovery pathway. So it's supposed to do quick recovery after surgery, walk first day, eat the first day. So it's called ERP. My question was, do enhanced recovery pathways affect opioid prescriptions after surgery? That was my first one. Then I changed it to be, our patients who undergo colorectal surgery under an ERP prescribe less opioids after discharge than patients undergoing surgery without ERP. So I changed like the time period to be specifically after discharge.
Great.
And how that compares to surgery.
Yeah, great. Okay. Other people make changes to hone their research question at all? Everybody was perfect at the very beginning. That's awesome. We didn't even need to do this. Yeah.
Whether the treatment of chronic heart failure should be, whether the treatment of chronic heart failure should be different between male and female, because we know that there are many. The first thing is that in the randomized clinical trial in heart failure, and then female are usually underrepresented. Then the second is that there are many different between male and female in biology and then in other social economic data or other psychosocial data. So because I found actually there are many epidemiology data showing that there are quite difference between female and female in clinical characteristics and then in their outcomes. So I think.
So the question was, should heart failure management be different between men and women? Yeah. Okay, and the men and women is you specifying a group to make it a little bit more focused. So, so I hope this is okay with everybody. I'm going to invite people to give input, and it's meant to be constructive. It's not meant to be pejorative in any way. So I'm just thinking that has a certain level of specificity, but that maybe it could even be more specific or more time sensitive. So are there other ways that other people, or that you think that you could push yourself a little to make that question a little easier to do the background literature search on? Any ideas?
Can you specify what you mean by management? Like, is that medication management?
It's medical management. So medical management, because that would be one whole literature on just the medications, right? So is it a biology focused? So that's one option. What's some other ideas?
Is it early stage?
What stage of heart failure? Is it end stage heart failure? Is it early in the disease? Because that literature is probably going to be, there's probably a lot, right? So as you try to hone in on what specifically you want to think about, I think setting some parameters like that could be really helpful. Yeah, Carlos.
The type of heart failure, low ejection fraction versus preserved ejection fraction, or the etiology of the heart failure.
Great suggestion. Yep. Did you have your hand up? No?
This is the gender disparities. This is the gender disparities. How does that play into, I mean, that's what I see as like your overall thing. If you're looking for gender disparities, then you can tie it to more specific stuff.
Yeah. A question I would have is, what's your outcome? So should the management differ for men and for women? For what? For readmissions, for quality of life, for, what, about what? So I think trying to tie some endpoint on there, some outcome on there would help you as you're flooded with literature on heart failure. Just trying to specify that a little bit. Who else wants to give an example? Yeah.
Sorry,
or ask a question. You can do that too, yeah.
Oh, sorry. Well, so when I had mine, I like what you said about the sub-question. But I don't have a point. So my question is, does severe maternal morbidity risk differ among women with and without a hypertensive disorder of pregnancy diagnosis? And then my sub-question is, are there differences by Medicaid insurance type or prenatal care timing or prenatal care initiation? And so one thing I think that came out of this was that I feel like when I think through the research question, there are different ways you can frame it, depending on what are you trying, why is this research significant? So for me, what's important is, okay, and this is using Alabama data specifically, but in a state that hasn't expanded.
And you could put that in the question. You could say in Alabama, or maybe you didn't add it here. Yeah.
Yeah, that's a good thought. But I think answering that question specifically has a policy relevant answer. So that was something that I wanted to incorporate into the question based on what I think this literature, additional literature might be useful for answering.
And that is exactly, so that goes back to the point about thinking about your target audience. Who do you want to take these research findings? What do you want it to do? What impact do you want it to have? Who do you need to pitch this to so that you, to Mike's point around thinking like, is this going to be an intervention? Is it going to be a policy change? So that you incorporate the right elements in your research question so that it's important. So an example of that I've had to kind of think about in my own research as I've sort of thought about things and the target audience has changed. When I first started out, I was thinking a lot about diabetes management, and I was thinking about community health workers interventions for diabetes management. And I was very focused on, glycemic control and health outcomes. And as time has changed and my focus has evolved and it's moved into more of the policy impact, I've had to start thinking about, and what's the return on investment? And how do I pitch this financially to the hospital? So, that's an example of how your trajectory and the way that you frame the questions and the things that you measure change over time. If you know that that's your endpoint, then you want to measure things in the language that the people who you're going to pitch it to expect to hear it, right? I think that's a really great point. Other examples of research questions, people? Yeah, Libby.
So initially I wrote, what barriers do transgender women in the Deep South face when accessing PrEP services? And I was thinking through how to make barriers more specific. So one thing that I thought was, how does stigma affect uptake of PrEP services and utilization of a PrEP clinic? Or I also thought that it could be changed to more focus on an intervention. So how do marketing campaigns focused on transgender individuals impact utilization of PrEP services among the transgender population in the South?
That's a great example. Both of those are great examples of taking something that was good, not bad, but making it that much more focused, which I think is going to make, now you can imagine looking through the literature with a very laser focused way to know what's there and what's not, and not kind of sifting through stuff that's sort of relevant, but not exactly what you want to do. So I think those are great examples. Others? Yeah.
So originally and I think this could still use some more work. So my starting question was, how do social networks form and alter treatment outcomes and improve behavioral interventions? And then I kind of have two different areas that I want to look at. So in residential and intensive outpatient eating disorder treatment centers, how do social networks form and groups predict symptom improvement in days to discharge?
That's a great, I might use that example next year. That's a really good example of a pretty good research question going to a much better research question. Could everybody hear her?
Can you say it more?
Yeah, can you? Yell it.
So the first one was, how do social networks form and alter treatment outcomes in group behavioral interventions? And then the second one was, in residential and intensive outpatient eating disorder treatment centers, how do social networks formed in groups predict symptom improvement and days to discharge?
That's like the lecture, right?
That's good. So you mentioned you thought it could be better. What piece is bothering you?
I think the piece on social networks is a little vague. Like, I know it's through social network analysis, but what components of social network analysis are the most important? And yeah, I mean, there's a lot of variation in residential and treatment, like intensive outpatient, so maybe that needs to be grouped a little bit too.
And this goes a little bit, I think, to what you were bringing up earlier, because probably in your head, some part of you saying like, well, I want to look at multiple different social media options. And so I don't really want to pick, but you could still have it be that that's your broader, and then you take it to that next level of specificity. So maybe the first thing you're going to ask is using, and I'm not even going to pretend to pick a social media network thing that would be relevant, but just focusing on one to begin with, right? Or sort of taking it like that so that you don't feel like you're boxing yourself out of those other options. It's just your first step.
Yeah.
So.
Well, and it's the relationships that form in groups. So it's the social networks, not the like.
Gotcha. Yeah. I saw somebody, I think, raising their hand over there. Does anybody else want to? Yeah. Go ahead, Sonny.
I'm struggling with how to make the question more specific, so it can be flat and more measurable. So people have input on that. That would be great. What I've been thinking about is kind of what Mom was saying. What's the most big, most broad is the relationship between structural racism and obstetric outcomes. And so the question I'm working on is, how do measures of structural racism in inpatient obstetric units impact inequity in patient-reported mistreatment during pregnancy and childbirth in women? And so I'm basing that question off of some data around that's now documented inequities between Black and white birthing people in their reported mistreatment during pregnancy and childbirth.
Can you read it one more time?
Yeah. How do measures of structural racism in inpatient obstetric units impact inequities in patient-reported mistreatment during pregnancy and childbirth in women?
Do you have specific letters in mind that you would like to test?
I am still trying to do some research on what measures already exist. And that's part of what I'm looking through in the literature. But most of those measures have to do with policies outside of the healthcare setting. And so that's part of my struggle.
So are you trying to measure, or are you analyzing the difference between measures and what they're able to predict? Yeah, it just, when you read it the first time, and then I got to be clear, because it sounds like your question is actually about the measures themselves and what the difference between the measures are, instead of maybe the patient outcomes or their experience of racism, but more almost like you're trying to refine a set of measures that you think are valid for this phenomenon, which may or may not be what you're wanting to. Am I?
Yeah, I understand the same way as Matt did,
Okay.
actually. That's maybe looking on differences in the scales or something else.
What I think I hear you guys saying is that you interpreted that as something like which measures of structural racism impact inequities in these. That's what you heard. That's how you interpreted the question. And I think the question is that what you meant for them to hear?
No, I'm not sure.
Okay.
I think that is actually really helpful. I think that my question, or what I'm hoping to ask and learn, is if measures of structural racism impact that inequity, and then if they do, which ones?
Okay.
So it's kind of, maybe that's two separate questions. I'm not sure.
Other input or thoughts on this to help her? Yeah.
Yeah, no, it sounds like the longer term goal is to be able to look at different sites with this, validated measure and assess this site scores at this level of structural racism, on a scale, and look at the variability there as it pertains to downstream outcomes in women's outcomes, right? So, but it sounds like that longer term question you might help guide where you are now, but you don't have what you need to answer that question yet. So the question now is coming back to more of what Matthew and Yulia was, what are the measures that are out there? How valid are they? So it sounds like, you know, that longer term question maybe is on hold, and there's another earlier question or questions that need to get addressed before you can get to the one that you really want to get to.
Yeah, yeah. That makes sense.
The other thing I think I heard you say, did you end that question within the US?
Yeah.
So that seems really big, since it sounds like the measures aren't necessarily clear. So I wonder if honing it into something that's a smaller geographic area or region, or even a single urban hospital, to try to say, I'm going to test this out here, see what measures exist, and have an impact on the data I can get my hands on most immediately.
Yeah.
And then look and see whether or not that's even collected nationally or not. So I wonder about just shrinking the
scope.
target. Yeah.
Yeah, I know the mistreatment data is national. So that's why I put the frame as United States, but I don't know about the measures.
Sure.
Yeah. Yeah.
And then even more specific, is this at an academic setting? So all of these, or are these at community hospitals, or what types of hospitals? So is this happening, and where's this data coming from? Does that make different overall?
The other thing that I'm thinking as you're talking, this isn't necessarily, I guess it lends itself to the research question, but if that data on the outcomes is nationally measured, thinking about, are there elements of structural racism that are measured nationally that don't have anything to do, to your point, with the health system? Like, can you look at GIS, any GIS measures related to neighborhoods or whatever, or distance to, I don't know, you know, anything that's measured nationally, and look at whether or not that links. That would still allow you to do it at the US, but you'd have to pick one measure. Structural racism, yeah. Possibly, yeah. Other thoughts or questions?
Can you look at like regional differences too, like the experiences of Southern Blacks versus like, you know, those on the West or East Coast or Midwest, things like that. Just so like it's again like just a little bit more specific, but you're still doing that national comparison.
Does that exist?
This is what it is.
Looking at whether or not the measures of, what was it? The measures of perceived inequity in treatment. So you said those measures exist, the outcome measures exist nationally.
The outcome measures exist for patient-reported mistreatment.
So my guess is someone's measuring that intentionally. And so there's a chance that that's been looked at regionally. So I guess I think digging into what somebody planned those, somebody's measuring that on purpose.
Yeah.
And so going and figuring out why they're measuring it and what they intend to do with that data before you go too far into it. Or sometimes, this is a bit of an aside, but sometimes those are great people to partner with, because you can, I mean, it's amazing, especially when you're a trainee. My experience is from academic medical centers, people just want people to work with them. They're usually happy to have a trainee call up and be like, can I write a paper on the data you're collecting? A lot of times people are very open, and it just takes you reaching out to say, I notice you're collecting this. I presume you have a big plan for this. I'd love to, this is an area of my interest, you know. It doesn't hurt. They could say no. They might say yes. Yeah, John.
I was wondering, as you were talking about administrative data, those big data sets, when do you find it makes more sense to contact someone who knows a lot about administrative data sets locally, as opposed to diving into the literature trying to figure out, are there measures about this? I'm thinking of some of the experts here like Emily Levitan, Gabrielle Roth, people who know, and Yulia with regards, they already know all these things that are collected and why, so it might save some time.
That is a great suggestion and a really great time saver. Because there are so many people here who do know about, and that's kind of, you know, when I was saying about the different disciplines and about the language, when you present and flesh your ideas out in front of other people, and particularly people who are experts in the data set or whatever it is, the data that you want to use. If there's people around here who know about it, it's way faster to go and ask them. Yeah.
Something comes to my mind now is maybe you can look in the women's health initiative. It's a big cohort study, and part of it is actually extracted from Birmingham, so maybe they have some measures of post-obstetrics outcomes.
And James Shikani and Beth Lewis would know about anything that is in WHI.
Going back here, very early on, thinking about different terms being used in different fields, and just thinking about it might not be exactly the same, but are there other terms or measures that have been applied that approximate structural racism that are available? Think about some of the work that
Social
Jules
sciences.
applied, that Jules, that exists measuring at the health system level that might not be called structural racism, but approximate or get close to as a starting point if it already exists and has been captured in a systematic, validated way. I mean, Jules, I figured out when was it perceived discrimination?
She did. Yeah, it was perceived discrimination and implicit bias.
I measure that at a system level. I mean, that's no. Okay.
I mean, it would have been good if it was.
Yeah, most of what I found have been perceived discrimination scores in others, but at the interpersonal level. But not elevated up to like organizational or system level. And so that's what I want to look at. But maybe I think the first question is, how does one measure it at that level?
Anybody else want to put their research question out there for help or for suggestions? Or have a great example of the evolution of your research question? Okay. Any other closing comments? Yeah.
I had a question.
Yeah.
How does this differ if you have more of an exploratory question than a specific testing or measuring this? Do you need it, as clear,
I think that's a really good question. And where this comes up a lot is if you're not necessarily doing like a quantitative study, but rather you're doing something like a qualitative study that is much more exploratory in nature. I think, especially when we have databases, people are like, oh, that's just a fishing expedition. In qualitative studies, you're almost supposed to do a fishing expedition, right, in some ways. So I still think that you need to go in with a focused question of sorts. It's just, it differs a little bit. But I think if you don't go into a qualitative study with a specific question, you end up with even more uninterpretable data than you might have if you'd actually had to select the measures, because people will talk about whatever. And you'll get themes, but they may not be directed towards what you're trying to get at. So I think, particularly when you're doing something exploratory in nature, realizing why you're doing it and why it needs to be exploratory in nature, and then framing the question in that way so that you definitely get what it is you're looking for, because you're going into it looking for something. It's not probably completely unformed. So to the extent that you want to frame that so that you get out of it at the end what you're really wanting to know, I think it can be looser and not necessarily so specific and focused as what we're talking about here, hypothesis type thing, but you're still going into it looking for something. So, Anna, do you want to add?
It depends on your choice of that first question word, right? Instead of why, forget the words why, you start to say how, what are perspectives, so how do people perceive? So your choice of that question word it opens up to a broad sort of understanding the phenomenology behind something. So that leaves something wide open, but it's still specific. It's like how do people perceive, how do moms perceive this, how do mothers perceive this? So then you're going in there, still directing it, but you're leaving it broad for their perspective.
Yeah.
Even with exploratory quantitative studies, would avoid the idea of I've got 1,000 candidate variables, so I'm just going to, you know what I mean? So I think even when it is exploratory to a certain extent, it is guided by some broader thought or theory or model. So being able to upfront limit it to, I mean, it's still exploratory, but I'm exploring these 10 candidate variables or these, 15. And at least for me, when I'm reviewing things, it says a priori, we selected these things. We didn't necessarily have a specific, we didn't work, but we thought for these reasons, these handful of variables, and we found these. I'm much more inclined than I see the article and go, we just, threw out the net, and this is what had a P of less than 0.05. And we didn't correct for the fact that we evaluated 1,000 different things.
Yeah, we didn't touch on that concept today, but that is super important. And do we have a talk on conceptual frameworks?
So in October, I'll pick that. I pick up on this and have my perspective.
Because that's a whole thing.
And I'm not a behavioralist, so I don't. But I kind of pick up on this, and we'll go from your question to thinking about your model, your data set, and just kind of going from the question to kind of actually doing a project to answer that question. Thank you for the preview.
That's all right.
October
Yes,
something.
Sean.
Rose is monitoring the chat online.
Oh, okay. I forgot to ask them if they had any questions. Or, yeah, great. Okay.
So Riley Santiago, who's one of our trainees from Tulane, asked, they said they could use some help making the research question more precise. And the question is, in rural, low-resource health systems, and Riley, feel free to get off mute so you can chime in, how can established quality metrics be adapted to predict sustainability of health outcomes? In rural, low-resource health systems, how can established quality metrics be adapted to predict sustainability of health outcomes? Riley, do you want to chime in?
You might still be on mute. Why don't we get initial, do I need to do something up here to get her off mute? Do I have to, sometimes I see people do that. They go and click off that microphone, right? Isn't there a thing? While Jean is figuring out how we can hear Riley, does anybody have any initial thoughts? Specify the health outcomes, yep. So is it cardiovascular, is it diabetes, is it, and which metrics? So being a little more precise about the metric and the outcomes. Other thoughts?
Maybe the rural communities, and is there specificity in terms of where they're geographically located?
It is rural, do we want rural in the whole country or regionally important rural communities? Okay, those are great suggestions.
Interesting question. I'd like to talk to Rafael because I think it's not framed exactly the way I would propose, and that you don't adapt quality measures per se. Quality measures are developed to not be adapted. They're minimal standards of care, and what you may want to try to do is you may want to use those to measure quality in a particular region, and then to think about what you can do, what sort of intervention you can develop to try to achieve that level of quality. But if they're good quality measures and there's national quality metrics that various federal groups and other organizations develop, they should be robust across populations. They shouldn't need to be adapted. And so that's why I wanted to talk to her, understand that better.
Great suggestions, and Riley, hopefully you could hear that, but if not, circle back around to Ken, because he has some good suggestions on tweaking and a little bit of reframing. She brings up a really interesting point that I think we should discuss for a minute, which is we've talked a lot about narrowing our research questions, right? And her comment is, won't that make it less generalizable? So I'd like to hear what people think about that. I don't think she's wrong.
So she's absolutely right. And yes, you know, the bigger the question is, the more public health impact it has. But when you're writing a K, or when you're writing even, you know, an R21, sort of an early career award, you know, you have to just be careful how much you bite off, because the K in particular, the question's important, but what's more important is you. Are you going to get trained? Are you going to be are you moving in a direction to become an independent scientist? And again, if you propose too much, if it's too grandiose, that's the easiest critique that a reviewer has, is to say, this is an R01. Read this all the time in K reviews. Great project looks like an R01, not a K project. You don't want to get that critique. So you really want to make it refined and make sure that you're able to answer the question. And better yet, that the answer, regardless of what it is important, right? So even if it's negative, it's still important. That's a project early on that you want to be sure about. That when we talk to our fellows who are in training for a very finite period of time, a fellow question is always one that, regardless of the answer, is something they can stand up and talk about at a national meeting.
And I think the other thing that you can do here, and because it is a dance between trying to have something that's broadly generalizable, but not so unwieldy that you can't actually look at it in your specific population. So it gets back to this idea of kind of closing the loop, I think, saying, you know, my broad interest is this, health disparities in diabetes. I want to look in this what seems like a pretty narrow thing, but that ties back to, and this is why the findings here are important to the broader question. So it's a little bit of a craftsmanship argument, yeah.
You know, as you were talking, even thinking about the broader question in some ways isn't a question. You spoke about being passionate. It's almost like having a professional vision statement, mission statement. So it's like, here I am, I'm in a T32 or a TL1, I got a finite period of time. I've got this broader vision statement for what I want to achieve in my career, decades hopefully, you know, doing this if I enjoy it. But then the research question is kind of right now, I need a bite-sized I'm not going to get it all done, right? I got hopefully a long time to do this. So what is the bite-sized project that aligns with my overall professional vision and mission, but that is potentially achievable, presentable, publishable, that I need this project as a stepping stone towards that bigger vision. So
I think our fundamental scientists, colleagues, lab-based scientists do this much better than those of us who do dry lab research do. They, you know, you're able to really hone in on something very small and very precise when you're doing experiments. But when you're doing population work or health services work, it's tougher. And I often hear people early in their career say, well, gosh, I'm just not excited about that. That's not important. It doesn't have public health interest. I don't think it's going to really be an important finding. Well, that may be true early on. And for those of you who are clinicians, you can relate to this too. You know, not every patient you take care of, you can help. And similarly, not all your research is going to lead to a New England Journal publication, but you got to get trained. You got to get experience. You need to develop preliminary data. You need to get your foot in the door and start to move in a direction that shows what you're about and what your niche is. And that's how you start to define it. It may not be groundbreaking early on. It may not. It probably shouldn't be, in fact.
Do anything important at first. Okay, great. Any other comments or questions? All right, as you guys kind of think about these things and hone your research questions, show them to your mentors, show them to your colleagues, and get feedback on them, because that will really help you prevent you from spinning your wheels a lot. Okay, thanks.